Welcome back to the Longevity Lab. Today we're going to talk about something simple but overlooked a lot, and that is screening and early detection of cancer. Now, let's remember that there are four major killers of humans today: cardiac disease, strokes, dementias, and cancers. The first three we can screen for, we can detect, we can prevent against, but cancer remains the loose end. I think we are on track to finding a way to prevent cancer, but early detection is something that we do not agree on yet. There are four main cancers that the medical community today recommends screening for: colon cancer, breast cancer, prostate cancer, and most recently, lung cancer. Now, when it comes to the rest of the cancers, some people tend to have more risk of developing certain cancers for which their doctor might recommend early screening, early detection, just because of a personal history, a family history, a genetic disorder, etc. But overall, when it comes to the longevity world, it's not agreed upon how and when to screen for cancers. So I'm going to simplify what are the protocols today, what are the methods today to screen for cancers, their utility, their pros, and their cons. Let's start talking about the most commonly used one, which is a whole body MRI. The whole body MRI is fairly easy, risk-free, as it does not have any radiation. It takes a long time to finish, about an hour and a half, depends how extensive we look in there, and it can detect a lot of cancers. There are a few cancers that the MRI cannot detect. Mainly, we're talking about the blood cancers like leukemias, and sometimes within the gut itself, it's very hard to see certain tumors. And breast cancer specifically cannot be detected by the current method of the whole body MRI unless you're specifically asked for breast MRI protocols. Now, for the cancers that the MRI is capable of detecting, it only would miss about 2% of these cancers. So it is fairly sensitive. But for people who have certain genetic disorders that they have a higher risk of developing certain cancers, this false negative rate goes a lot higher. The problem with MRIs, they're very expensive and they're not widely available, and it might be very hard to convince your doctor to get it ordered for you. So I think a whole body MRI is a reasonable way to look at and screen for early cancers if done correctly in the right settings. The other one that we have recently started using, recently we're talking a few years now, is the cell-free DNA testing. And it is a simple blood test that you do it at your doctor's office, and that detects fragments of DNA of tumor cells. Now, the beauty of this test that it's simple, easy, and it detects a lot of cancers even before they become a thing. So they could be very, very small, not even detectable by any imaging studies, including MRIs, which can give us an edge, but at the same time can lead to sometimes overdiagnosis, overanalyzing, and unnecessary procedures. Because remember, our bodies are smart, and if our bodies are well enough, healthy enough, metabolically fit enough, they should have the ability and the capability to fight off cancer, kill cancer cells on daily basis. So there are certain reports of positive results on these Galleri tests or cell-free DNA testing that did not really translate into diagnosis of cancer. So it would find cells of tumor X, and we would go fetch for that cancer and we will never find it. That leads to excess anxiety, and that is one of the major cons for this kind of testing. Now, on the other hand, it can literally save somebody's life without having to go into extensive measures like chemotherapy or immunotherapy or radiation therapy. A simple small surgical procedure removing a small tumor that would have not shown up otherwise unless it is in an advanced stage. This is where it has a huge beneficial value. Now, this test is not cheap and most likely would not be covered by insurance as of today. But I think eventually it will be the gold standard for cancer screening when it is fully optimized. Because there are a lot of cancers and a lot of tumors, especially the blood tumors and other solid tumors like the thyroid tumors, that these tests are fairly insensitive and sometimes does not even detect any of it. So we have to be careful when we say that this is negative. When we say it's negative, it does not mean that we guarantee you 100% that you don't have any cancers. Now, think about it this way. Now, the third option is genetic testing. And I really do not look much at genetic testing. I do not do it much at the clinic because the majority of cancers are actually not inherited. The majority of cancers are acquired. Now, when we talk about these things, we have to keep in mind that there are agreed upon methods of screening and early detection for certain cancers. And as we mentioned, the colon cancer, the breast cancer, prostate, and lung cancers, we have very efficient tools today for early detection. The colon cancer, the gold standard today is colonoscopy. And that remains the gold standard for many reasons. Number one, it can look and find polyps, which could be precancerous, but at the same time, and most importantly, can be removed on the spot. Now, this tool you cannot match with any other form of screening for colon cancer, and the sensitivity and specificity is very high. The second method is a stool test that looks at fragments of DNA of tumor cells, and it is very sensitive. It will detect up to 95% of cancerous lesions in the colon, but it's not as sensitive in detecting precancerous lesions like polyps. And even if it detects them, you still have to follow that up with a colonoscopy to confirm and remove. The third option is the blood test, which we talked about a little bit ago, and this one specifically was designed for colon cancer, and that is a cell-free DNA test. The problem with it is not as sensitive as the other two. It has comparable sensitivity to the stool test, but the sensitivity towards precancerous lesions is not good at all. But the beauty of it, it's easy, simple, and it is convenient because a lot of people do not do the screening just because of the inconvenience and the risk that is associated with colonoscopy and the inconvenience that could be associated with the stool testing. Now, the second major cancer that the medical community agrees upon screening protocols is breast cancer. Mammography remains the gold standard for screening today, and the problem with it, it has radiation. It is very uncomfortable, but at the same time, we're seeing more and more evidence of radiation-induced issues in the future, and because it's very uncomfortable, a lot of women just don't like doing it. So that's why we have other options for screening. Number two is an MRI of the breasts with and without contrast, and that is the most sensitive but not the most specific for cancer detection. So it can find a lot of lesions and it can lead to overdiagnosis, but it's radiation free and it's a lot less uncomfortable than the mammogram. But the problem with it, a lot of the times, is not covered by insurance and it can be very expensive. It's not entirely risk-free. The other one is the breast MRI. It is not entirely risk-free compared to the other form of the MRIs we talked about before, because this one includes contrast, and there is a very small chance of developing contrast-related issues, and it's very, very rare, but it's not risk-free. And the other problem with it, it's very expensive if the insurance does not cover for it, but it has a very high rate of detection of tumors. The third option is the ultrasound. The ultrasound is very convenient, cheap, but it's not as sensitive or specific as the MRI or the mammogram. And the fourth one is thermal imaging, and thermal imaging is still under development. I think it would need a lot more work and a lot more accuracy to depend on it and make it the gold standard. And the third cancer, and that is one that we kind of agree on, not entirely, is the prostate cancer. The reason I say that is because prostate cancer is, for the most part, a very slow cancer. And a lot of men who have prostate cancer will die with the prostate cancer, not from the prostate cancer. So early detection of prostate cancer can lead to a lot of procedures, a lot of interventions that could have been avoided because not a whole lot would have been different. But at the same time, there's this subset of prostate cancers that can be aggressive, can go to the bones, and can cause the man's life to be miserable, a lot of pain, and eventually can lead to death if it's fully metastasized. So the patient here has a lot of say when it comes to getting screened for or even doing anything about an early detection of prostate cancer. So if they have a very high PSA and we do an MRI and we found a nodule, a lot of men do not want to go through prostate biopsy if they are in the mindset that I want to keep an eye on it, and if it grows, we'll do something about it, but for the moment, I want to leave it alone. So that is one of the tumors that, yeah, we have recommendations, but a lot of men and a lot of doctors still do not adopt that entirely. The fourth and last one we want to talk about today is lung cancer. So most recently, we have seen recommendations coming across with doing a low-dose CAT scan of the lungs, and that is very capable of detecting nodules, and these are precancerous lesions, and detecting them early, following up on them early and removing them surgically can be entirely life-saving and can really save the man's not just life, quality of life, with avoiding further treatment like chemotherapy, radiotherapy, immunotherapy by a simple, short, usually covered by insurance CAT scan. And it is superior to the MRI when it comes to detecting nodules. Now, having said that, this is when it comes to predicting cancer and early detection of cancer, but there's this big question about preventing cancers. We're gonna make a whole different video about prevention of cancer and how can you minimize your risk of cancers, whether it's by exposure, food intake, etc. Stay tuned. Please like, subscribe, and share if you found this video useful.